New patient screening point number 2, you have to make the problem real. How do you make the problem real? Well, you ask them questions about the problem, and specifically about how that problem affects their life. You can ask them if it affects how they do their job, if it affects how they interact with their children, if it affects any sports that they like to do, if it affects any hobbies that they like to do, if it affects their relationships with their loved ones. You can ask them if it stops them from doing the things that they love to do, and then have them describe what those things are. Have them, in other words, relive the moments of how that problem is affecting them. The more that they are talking, the more they are starting to fully understand this problem is affecting them. If you're doing most of the talking, you're not getting anywhere with the patient. So the job is to ask them questions. Continue to ask them questions to get them to realize that that problem really is not just messing up their life, but to the point where it's ruining their life. If you can get them to that point where they truly understand how that problem, maybe not at this exact moment, is ruining their life, but if it continues to get worse, like 5 years ago was as bad as it is now? Well, no, it wasn't. So in 5 more years, do you think if you don't do anything, it's going to continue to just stay the same? Or do you think it might get worse? Yeah, well, how bad's it got to get until you decide to do something about it? Do you really got to wait till you can't walk, till you can't move, till you have to lock yourself in your bedroom and turn on all the lights because your headaches are so bad? Do you really want to wait to that point before you decide to do something? Hopefully you don't. And if you don't, I can help you. Dr. Brent, over and out.